Good morning, ma'am. My name is Robbie Genitalia and I am your nurse for today. So what we are going to do is to assess your genitalia, your anus, and your rectum. Okay? To start, could you please put your lab gown? Okay, good. So we are now ready to uh, inspect the mons pubis. So before proceeding to the implementation, we will be needing to position the client supine with the feet elevated on the stirrups of an examination table and alternately assist the client into the dorsal recumbent position with knees flexed and thighs externally rotated. We will now inspect your external genitalia. So your pubic hair has an inverted triangular pattern as you can see here. Okay, and it has coarse and kinky hair as I can see here, which basically represents as normal finding. Moving on with the inspecting for the labia majora and its perineum, and we should note if there are swelling. So here is the labia majora. Okay, so I don't see any no swell. Okay, I don't feel any don't see any swelling. And for the perineum, there's no excoriation. Okay, and it indicates normal finding, which is good. So for inspecting the labia minora, so if this is the labia majora, this is the labia minora. So as you can see, the clitoris and the urethral meatus here. So I can observe that there is no lesions, no discharges. There's also no swelling, and I don't see any excoriation around it. So next is we're going to palpate the Bartholin glands, but before that we should use the lubrication. Inspect the Bartholin glands. So first is should open it this. Okay, so then it should be like the index fingers and the middle fingers straight up and enter the twist. Okay, so now I am palpating if there are any presence of swelling. Okay, so I can feel that it is not there is no lesions, there is no swelling. Okay, there is no tenderness or any discharges. Okay, so going in, we should palpate the urethra. So I will now put it in my fingers. Okay, so this is it. So we should try to push it in and out so that we could see if there is discharges. So if there are discharges, it is a regular occurrence, unless if it's color yellow or green. Okay, pushing it in down. If the client complains, there could be a sign of symptoms of urethritis, and I'm pulling it out. Okay, so I can observe that it is not yellowish or green. The discharge is normal, which is good. For the internal genitalia, we need to inspect the size of the vaginal opening by moisturizing the glove index finger with warm water and gently inserting the fingers into the vagina. Okay, so I'm inspecting the size. It should range from 2.75 inches about to 3 inches, and if it gets aroused, it would increase to size to 4.25 inches to 4.75 inches. Okay, index finger, finish this. So we should separate the labia minora. So ma'am, can you please could you please squeeze size around the fingers? Okay, so I don't feel any bulging or any discharges of urine. Bulging, it could get swollen and could cause burning pain. can urinate if they are bulging. Okay. For the cervix, okay, so I will now look at the inside of it for color. Okay, the cervix is pink, is smooth, and even in the OS is located at the center, which is normal. And I will now unlock it. I will now obtain a specimen for pap smear and indicate if there is a culture to test for STD. For performing the bimanual examination, okay, so inspecting the anus and perianal area, I don't see any lumps. Okay, so no lesions. Okay, so no rashes. I don't see any redness. Okay, so the color of the anus is darker. So it is often normal and nothing to be concerned about. For the sacrococcygeal area, so there's no swelling, no redness, no dimpling, or any presence of hair. So there's a small presence of hair. Next is we should inspect for the rectal prolapse by using the with Valsalva maneuver. So it occurs when the rectum or the last section of the large intestine falls from its normal position within the pelvic area and sticks out through the anus. So basically the word prolapse means the falling down or slipping of a body part from its usual position. So the current symptoms of it is the pain in the anus. So for now it is normal. Next is palpate for anus sphincter. Index finger. Okay, so we'll now insert it. Gently push. Okay, I don't feel any tenderness. There is no nodules or hardness. My fingers, it is already lubricated. Insert it now. Okay, there is no the rectal mucosa. There is no tenderness, no nodules or hardness. For the I'm palpating the peritoneal cavity. So also there is no, don't feel any tenderness or nodules, or could be signs of rectal shaft. So if there is any presence of blood in the feces, we will be needing to perform for the occult blood test. So for the evaluation and documentation, the walls is pinkish in color. So for the anus, the consistency, it is rubbery with firm and smooth surface and probable sulcus between the right and left lobes. There is no tenderness, and I don't see any nodularity. Also, after removing the speculum, it is moist. It has normal discharge, and it is clear and thin. It is odorless.